Τρίτος κατά σειρά ομιλητής στην ημερίδα ήταν ο καθηγητής κ. Samer Srouji. Το θέμα της εισήγησής του είχε να κάνει με τις τελευταίες εξελίξεις στην αρθροσκόπηση για τη θεραπεία των διαταραχών της κροταφογναθικής άρθρωσης. Mr. Srouji, thank you for being with us. Many people suffer from TMD disorders. So, what are the causes and the symptoms of this dysfunction?
The most problem in this TMD function is the pain. You know, people have two important symptoms. The first one is pain. They have pain in the TMJ. They all the time saying that they have a painful point near their ear. The second is the restriction of mouth opening. They can't open their mouths properly. Third is they can't chewing properly, and it's make for them difficult to in their daily life to manage. So they have chronic pain all the time, and they refer to us to try to help them in this issue.
When is surgery needed, and what is the most advanced technique?
Before we just refer to the most advanced technique, we should understand that this problem could be a result of stress, of our daily life stress, because many of these symptoms related to our daily life, which mean we don't sleep well, we are very stressed before exams, we have hard day or hard situation. So it's something that related to this area, because we all the time try to clench our muscles near this area, or we have at night bruxism. We call it bruxism. We tied our teeth so strong that it's affect this area. So if the conservative treatment didn't work well, we go to the surgery. And the conservative treatment is give them medication, to send them to physical therapy, or to give them a splint, a night guard splint, which will relieve part of the symptoms, mainly the pain. And in the next step, if this conservative not work, we have the advanced treatment for surgery, which is minimally invasive treatment. We go with arthroscopy, and we have a new technique that we can do not just a diagnostic treatment by arthroscope, also a surgery by arthroscope. So we can go through through very small cannula to the TMJ region, diagnose the problem. Then we can, in the same system, we can use surgery instrument to make or to relieve or to treat the problem inside. One of the most instrument that we are using is the laser, which is a very specified to the TMJ. It's Holmium-Young laser, which we go through the trocar and through the same system, and we make the treatment inside the TMJ. Our results from last 5 years, when we start use this system and we develop part of this system, very good. And we published lately for 1 year a paper in very high scientific journal about our result, that if you use this arthroscopy in the real diagnostic problem, you can have very good result in these cases.
What are the benefits of the operative single cannula arthroscopy, and what do clinical results show?
So, as I said before, this technique is come to change concept of the two cannula technique. because if we use the minimally invasive, we so use one cannula, okay? And the classical one was we should use two cannula, one for inspection and one for surgery. And in this technique that I called it OSCA, you use the only cannula also for inspection and for surgery. So as you can imagine, it's one puncture, it's not two puncture, okay? So it's less invasive, and you have the same results as the classical was with two puncture, which make it much better. This is the first thing. The second thing is for surgeon or doctors who want to use this system, the curving learn for this system, it's much easier than the two cannula, which make it more applicable in clinics and hospital.
Thank you very much.
Thank you.